What rhinoplasty is it's a procedure that's used to change the shape of the nose. One of the most common concerns my patients express is that their nose is a very dominant facial feature, and it's the first thing that people see when they look at them. So I think with rhinoplasty, what we're really trying to do is to tone down that feature so that it isn't the most prominent and most obvious feature on a person's face. Obviously, we want to do that in a way that is in keeping with their ethnic background and their other facial features so that it looks balanced and natural. The net effect is that we really want it to be part of the face, but not the main focus.
Today we're going to be meeting Courtney. She's just turned 18 and she's thinking about having rhinoplasty.
Well, I'm currently taking a year off school and I plan on traveling towards the end of the year and then going back to school in September. So I am starting a new chapter in my life and I think it would be nice to go away and have all my insecurities kind of tied up. My friends and family have been really supportive. They're really happy that I'm doing this. You know, they're excited that I'm going to be happy with the way I look and very content. I initially went to my family doctor and she was adamant about me seeing Dr. Buonassisi. She highly recommended him and gave me a referral right away.
So Courtney, you're here to see me today about perhaps having a rhinoplasty.
The preoperative consultation, in my opinion, other than the surgery, is the most important part of the rhinoplasty experience. This is where I learn what the patient is looking to achieve. It's also where the patient learns about what is physically possible. So by using computer imaging, I can talk to the patients about what degree of change is going to make them most happy. This is also a bit of a negotiation in that there are things that can be done physically and things that can't. And I think that if we can come to an agreement during the preoperative consultation as to what the nose is going to look like and what is realistic, I think it really helps with the expectations post-operatively.
So what I'd like to do now is just have a good look on the inside of your nose. This is actually called a borescope. It allows me to actually look all the way down your nose with binocular vision. It's a very useful tool. It might be a little bit bright, so just mind your eyes a little bit.
So it's nice meeting you, Amanda. You're here to see me today for a rhinoplasty consultation. What I'd like to do first is examine your nose. First of all, make sure your airway is clear, that your septum is nice and straight. And then also take a look at some of the features of your nose and feel them to see why they may have a certain shape or size. Now I'm just going to have a quick look at the tip of your nose as well. So your cartilages are a little bit soft, and that's why your tip tilts down a little bit. So I'm going to actually be supporting your cartilages and making them a little bit stronger. That will keep them elevated lifelong. And then the bridge of your nose, where you've got a little bit of a curve, is some of it is bone and some of it is cartilage. And that's fine. It's just requires slightly different techniques to take down those two types of tissues.
I really wanted the results to be natural. You know, I don't want it to look like I've had surgery done. I just want it to look way more balanced and really look natural and proportionate to my face.
What is the key to getting a natural result with rhinoplasty? I think the key, first of all, is to be conservative. Making drastic changes to a person's nose often makes it look so different that it may not necessarily suit their other facial features or their ethnic background. The other thing is that when you make a change to one nasal feature, often there is a secondary change that needs to be made to another feature. So for example, taking the bridge down may also require tilting the tip up a little bit. And I think it's important to take into consideration several of their nasal features and perhaps making small changes to all of them so that their nose looks natural rather than making a big change to only one of their features.
And my first phone call with Angie was the first thing that really made me feel most comfortable with this cosmetic surgery office. I was totally impressed with the communication and how comfortable she made me feel.
So Mandy has decided to schedule her surgery. So now we're going to kick off the process of getting her prepared. We have a very detailed package of pre- and post-operative instructions which we'll send to her. This will give her some information about how she can prepare both for the surgery and the recovery period.
Having the cast removed was totally exciting for me because I had been anticipating it for the entire week. Once I saw the cast come off, it actually was completely painless and I was just completely happy to see my results. It was exactly what I expected. And my recovery process went very smoothly, didn't hurt at all.
So let's just have a quick look. That's great. That look is going to look fantastic.
I had barely any bruising, only a little bit on the tops of my cheeks, a light yellow color. I see it's like a little bit swollen, but it's totally cool.
Hi Amanda, it's nice to see you again. It's been several months now since your surgery. So you've been at home relaxing over the summertime, and I'm seeing you again now in follow-up. So what we did was we took down quite a curve on your bridge and also tilted your tip up a little bit as well. And that gives you a much
shorter looking nose because the bridge is now a little bit lower than your tip. And also the angle that is formed on your profile view between your tip and your lip is nicely elevated now. So I think you have a nice natural looking result, and I'm really pleased.
I really enjoyed my experience with Dr. Buonassisi. Not only Dr. Buonassisi, but Angie and the rest of their staff were totally professional and very informative, on the ball. Every concern or question I had was immediately answered. My favorite part of my nose now is looking at it from different profile angles, because I got a refinement just to soften my look and make my nose look more feminine. I'm so impressed with it, and I just feel very confident.
I'm really looking forward to seeing Courtney today. She's 3 weeks post-surgery at this point.
I feel great. Going out with my friends, awesome. I don't have to worry about a certain angle. I love turning to the side now, so I'm so happy when people can kind of just get the whole view of my face rather than me kind of being self-conscious and almost turning away sometimes. The staff was so nice, being able to ask questions and call the office whenever I was feeling a little iffy about something was great. Communication was awesome. It was good to have my questions answered, especially during the recovery period. There's some things that you're not quite sure about, but everyone was here to answer them really efficiently and very nicely. The surgical process and the recovery process is so worth it. You're going to feel so much better about yourself, and it's really going to give you that confidence to really go on in life and do what you want to do.